Dr. Smith, physical therapist here, and I wanted to make this video today in regards to a recent bill that was proposed that intends to forgive student loan debt for frontline healthcare workers during COVID-19. Now, you may have heard about this bill through a variety of news outlets. I have some pulled up here. Maybe you've seen it on Facebook, or maybe you just hear healthcare providers talking about it. Despite all of these sources, many people are missing the specifics. So today we're actually going to go into the bill, look at the specifics, and break it down. I'm going to give you my take on the sections and the whole bill. And if you want to give your take, go ahead and comment below in the comment section. So one distinction I'm going to make first is that this bill was proposed on May 5th, 2020. Today is May 7th, 2020. So if you're watching this video after May 7th, some things may have changed. So let's pull up the bill here and give me 1 second to kind of catch my breath and get a sip of coffee. Hold on 1 second. I don't know why I grabbed that cup backwards. It was just sitting like that. But anyway, let's go into the bill and hopefully you guys can hear me okay. So this bill was proposed by Ms. Carolyn B. Maloney. The bill's intention is to provide student loan forgiveness to healthcare workers who are on the front lines in response to COVID-19. Section 1 is the short title of the bill, and this is a title of what it can be referred to as instead of like the actual number and what have you. But the short title of the bill is the Student Loan Forgiveness for Frontline Health Workers Act. Now we're going to go into Section 2, which talks about federal student loan forgiveness. So let me make the distinction between federal student loans and private student loans. So federal student loans usually come from Fed Loans, Navient, Great Lakes, what have you. And these are servicers, once you fill out your FAFSA, that you actually don't even get to pick. They're assigned to you. It's a weird system. And it's loans that are assigned to you through a servicer by the government, where a private student loan would be that you take out a private loan for school from Wells Fargo, what have you. I'll break that down a bit more as we go through this, but this section specifically is talking about federal student loans, such as Great Lakes, Navient, Fed Loans. So Section 2, Part A, forgiveness required. Notwithstanding any other provision of law, the Secretary of Education shall carry out a program in accordance with this act to forgive the outstanding balance of interest and principal due on the applicable eligible federal student loans of borrowers who are frontline healthcare workers. So what's concerning to me is it's saying the Secretary of Education has to do something when currently she's known for notoriously not doing anything, even when court ordered, still doesn't do it. So huge red flag that this may not happen. However, it could, but the first thing I'm seeing here is, well, you leave it to the Secretary of Education. Unless you get a new one, good luck. Part B, and that's not even political. That's just based on someone being court ordered to do something and not doing it. So then we have Part B, the method of loan forgiveness and carrying out the loan forgiveness program required under subsection A, the part we just talked about. As soon as practicable after the Secretary of Education has confirmed that an applicant is a frontline healthcare worker who is a borrower of an eligible loan, they are going to contact the holder of the loan. Again, this can be, for an example, Fed Loans, and then they're going to assume the obligation to repay that loan. So they're going to have to, once you qualify, which we'll get into later, they're going to then have to contact your servicer for you. I'm not even sure if you can be involved in this process. It doesn't sound like it. And be like, hey, we're taking over this loan. And they're going to cancel the outstanding balance of interest and principal due on the applicable eligible federal loan. And then there's Part D, Part E of such titles. We'll get into that at some other time, but not today. So this is saying that the Secretary of Education has to make a program and then has to contact these servicers and be like, hey, we're going to pay this debt back now. It's all forgiven. Will that happen? Maybe. How hard is it to qualify? We'll see as we go through the document. Part C is repayment refunds are prohibited. So if you just paid off your loans, you're not getting that money back. If you're making payments now, and again, this is the federal section, there's a private section we'll get into next. But under the federal section, if you are making payments or say you just worked your ass off and paid off all your loans, well, you're not getting any money back, no refunds for anybody. So people will say that's not fair, could hold up the loan, the bill. But I understand why they said no refunds, because they don't want to just be giving out money after they just forgave trillions of dollars, which I'm assuming most of the debt that they're trying to forgive is for physicians and other healthcare workers that usually have on average about $200K or more in debt. I personally know some physicians that have $600 to $800K in debt. So I can see how this is not going to be a repayment refund situation. So that's why those are prohibited. Again, that doesn't apply to everybody, but there are some cases where they would be losing a lot of money. And in general, they're just not going to give you your money back. So we'll go into Part D here, exclusion from taxable income. Right now, when your loans are forgiven, you have to report it as taxable income under standard federal loan repayment terms. So the difference here is if you do like public loan service forgiveness program, when it's forgiven after 10 years of you being an indentured servant to some organization, that's actually not reported as taxable income, so you don't pay taxes on it. But if you just do a standard repayment program for like 25 years, what have you, well, then you do have to report it as income and pay taxes on it. That's usually why you save money for taxes. Under this, your loans are forgiven, no taxes, not reported as income. So it's kind of ideal if this does get implemented and you have a lot of loans or just loans in general, you're basically getting a huge tax break. Notice the borrowers and statements. What this section is saying in a quick summary is that they have to notify you 2 times a month, all servicers do, that this program exists. Will they actually do that? Probably not. We've seen some shady shit by Navient in the past. I could totally see them not doing this or putting it like on the back of a sticker that's like you would usually throw in the trash or throw it in the trash. So just go through here, just basically saying, they need to let borrowers know this program exists. Section 3 covers private loans. So we just went through Section 2, which is federal loans and deals with the Secretary of Education. Section 3 is going to be private loans. It's going to deal with the Secretary of the Treasury. Now, this is important to note because we're going to see why a bunch of problems are going to arise when we have 2 separate entities doing the same thing for different reasons. Private loans really depends. I'm not really sure how I feel about private loans being forgiven because I have some physician friends who, maxed out their federal loans and they had to take private loans so they could, eat while they were in residency. So I could totally see why this would definitely apply to people in those situations. However, there could be some people that just, have really good credit and just max out their consumer debt. Well, not max out, but just take out a bunch of private student loans or maybe didn't really use it for something as necessary as medical care of treating on the front lines. This is where it's going to get tricky. Again, it depends. Maybe they didn't qualify for federal loans because H-1B visas or what have you. I'm not really sure how that works, but private loans can be a bit trickier, and I'm not really sure how I feel about this section. However, I could see why they included it based on the example I gave of people needing to take private loans out after they max out their federal loans and their physicians providing necessary services. So this basically is going to say the same thing as Part 2, but it's going to be worded a little bit differently, and it's going to require the Secretary of the Treasury. So the Secretary shall repay in full the outstanding balance. The methods are very similar to the part we just read. No refunds for private loans. You do get excluded from taxable income. You get the notice to the borrowers. And then we're going to Section 4, which is coordinated program requirements. So far we have loans that are federally borrowed, loans that are privately borrowed, and they're supposed to all be forgiven by a joint effort between the Secretary of Education and the Secretary of the Treasury. So is this going to be efficient? I don't know. It sounds like it's to be kind of confusing and very, very hard to implement. Plus, this might get chopped up a bit. As I mentioned earlier, we don't know what's going to happen after today. So Section 4, coordinated program requirements. The secretaries concerned shall jointly develop the program required under Section 2 and Section 3 of this Act and shall coordinate and consult with one another in carrying out such programs to ensure that they determine the eligibility the eligibility is uniform and consistent across both programs. Okay. That frontline healthcare workers who are borrowers of both can put in one application. So that is a huge red flag to me. If you have both, it would probably be easier to put in one federal application and then one private application. However, I guess if you qualify, it's just easier to forgive all of them. I just do think this might get tied up and just take a very, very long time. So it is nice that you can do one application, but I believe it would be easier to do 2 applications just in general. And also, I think some people that have private loans wouldn't mind keeping their private loans if their federal got forgiven or what have you. But that's going to be an individual case-by-case basis. But that is going to be a shit show. One application for both sets of loans. It's No, you should have an application for each set of loans just to make things more clear and concise. Borrowers with outstanding eligible federal student loans and borrowers with outstanding eligible private student loans are notified of the availability of both programs under the Act. Yes, we already talked about notification. They're made available to frontline healthcare workers. Okay, who were borrowers of student loans, eligible for student loans, or both. And also, this is actually kind of good, especially for private student loans, is that if somebody died as a result of coronavirus, it's not going to be transferred to a family member. Usually under federal student loans, those can't get transferred, so it doesn't really matter. But under private student loans, it's kind of ideal that it's not going to be transferred to your estate. So that's actually a very good clause there, especially for private loans, because sometimes your family member didn't take out that loan, but it can be transferred due to such laws. Notice to the public: no later than 15 days after the date of enactment of this act, should you notify the public, higher education institutions, and lenders. Basically, don't be shady about it. Be easy and understandable. So this is kind of addressing what I said earlier, where people could be a bit shady about it. It's actually stated here that they can't be. Will they follow this? Who knows? So the application period. An individual may apply for loan forgiveness under Section 2 or under Section 3 or both by submitting an application to the secretaries concerned during the period that begins on the date that is 60 days after the date of enactment of this act and that ends on the date that is 2 years after the end of the qualifying period. And now we get to the important part: determination of eligibility. So development of application not later than 60 days after the date of enactment of this act. The secretaries concerned shall jointly, in consultation with the Secretary of Health and Human Services and the Intergovernmental Working Group. So now we have 4 secretaries or 3 secretaries. I'm not sure if that last secretary is the secretary for those 2 things, or there's 2 secretaries, but we have the Secretary of Education, the Secretary of the Treasury, and now we have the Secretary of Health and Human Services. And I'm assuming the Secretary of Intergovernmental Working Group, or maybe that's the same secretary, it's not very clear here, to develop one application for borrowers of both eligible federal student loans and eligible private student loans to apply for loan forgiveness or loan repayment, or both under this act. Okay, so we have 4 secretaries, or 3, I'm not really sure, who must meet and start doing what this act says. Will that happen? We don't know. Application requirements. The application required under paragraph 1 may only include such information as is necessary for the secretaries concerned to make a determination of whether the applicant, A, is a frontline healthcare worker without consideration of the period of time the applicant served as such a worker, and B, is a borrower of an applicable eligible an applicable eligible private student loan, or both. So this is kind of confusing. May only includes as is necessary, or is a frontline healthcare worker without consideration of the period of time the applicant served. So maybe somebody that was furloughed isn't working and could apply for this loan. That's kind of shady, because people will just be applying that are licensed in the state but weren't working during this time or saw COVID patients. So this could be a huge mess. And I hope I interpreted that right. I may have not. If I got that wrong, comment below. A determination. No later than 30 days after the date on which the secretary is concerned receive an application from an individual in accordance with the act. Wow, they're going to get back to you in 30 days? Okay. With the amount of applications I'm expecting, it seems nearly impossible. Confirm that such individual is a frontline healthcare worker who is a borrower of a loan. Then notify them of such confirmation and grant them the loan forgiveness or both loan forgiveness depending on the loans. And part B, determine that such an individual is not a frontline healthcare worker who is a borrower of an applicable loan. So you have 30 days to say whether you're a frontline healthcare worker or you're not. That's just kind of not as clear. Part 3 here. Okay. Basically says the same thing. Sorry if I went up a page there. So if they determine that you're not an applicable worker, they have to include that the application was denied, the reasons for the denial, and if the application was denied because the secretary is concerned determined that the applicant was not a frontline healthcare worker, an explanation that the individual may appeal to the denial to the intergovernmental working group within 30 days. So say you get denied, and even though you have 30 days to appeal, or else I guess you're SOL there. Okay. And then we have treatment after successful appeal. In the case you win an appeal, the IWG in accordance with Section 7, then your loans get forgiven. So what the hell is the Intergovernmental Working Group? No later than 30 days after the enactment, the Secretary is concerned that the Secretary of Health and Human Services should jointly establish. Okay. So now we know what the IWG is. We didn't know at first, but now we know what it is. It's going to be 9 members, who 5 members shall be selected by the Secretary of Health and Human Services from employees of the Department of Health and Human Services who are knowledgeable concerning the education, training, employment, and medical practices of healthcare professionals and the healthcare workforce. Okay, so basically what they're saying is that they're pretty sure that the Secretary of Education and the Secretary of the Treasury is incompetent to determine who qualifies and who doesn't. So they're actually using the Department of Health and Human Services, which makes more sense. And they're actually doing a vetted process to make sure that we see people that apply are actually going to have a fair treatment of the application. Will that happen? We don't know. 2 members shall be selected by the Secretary of Education from the employees of the Department of Education, and 2 members from the Secretary of the Treasury. So we have 5 HHS, 2 from Education, and 2 from Treasury. I actually like that because usually people from Health and Human Services will be like, 5-4 and hopefully rule more loan forgiveness than not, especially for frontline healthcare workers. Their duties are to develop a procedure or list of requirements to determine whether an individual has made significant contributions to the medical response to the qualifying emergency for purposes of determining whether an individual is a frontline healthcare worker as defined in Section 9(1)(c), and determine what information an individual needs to provide for the Secretary is concerned to determine whether it has made significant contributions to the medical response to qualifying emergency for purposes of determining whether that individual is a frontline healthcare worker as in 9(1)(b). No later than 15 days after the date on which the council is established, report the information described in paragraphs 1 and 2. No later than 60 days, develop a process, and then deal with the appeal process. And it's just basically how they're going to set up this committee. So then we have the termination of authority. The authority of the Secretary is concerned to carry out the loan forgiveness program under Section 2 and the loan forgiveness committee, and the authority of the IWG to carry out the activities authorized under Section 7 shall cease on the date that is 100 days after the end of the application period described in Section 1. So you basically have 180 days once this is in place to do all this. So this is the most important part of this video, and that's going to be Section 9. What is the definition of a frontline healthcare worker? The term frontline healthcare worker means an individual who, in exchange for payment or as a volunteer for any period during a qualifying emergency, is a doctor, a medical resident, a medical intern, a medical fellow, a nurse, a home healthcare worker, a mental health professional, or other healthcare professional who is licensed, registered, or certified under federal or state law to provide healthcare services and who provides COVID-related healthcare services. Part 2. A student enrolled at an institution of higher education in medical, nursing, or other relevant healthcare program of study who provides COVID-related healthcare services. Part 3. A laboratory worker who conducts, evaluates, or analyzes coronavirus testing. Part 4. A medical researcher who conducts research related to the prevention, treatment, or cure of the coronavirus. Or Part 5. An EMS worker who responds to health emergencies or transports patients to hospitals or other medical facilities. Or, and we have Part B here, does not meet the requirements of any class under subparagraph A, but is a healthcare professional who is licensed, registered, or certified under federal or state law to provide healthcare and has made significant contributions to the medical response to the qualifying emergency. Okay, so this is a whole range of people here. You have, I'll use my own profession for an example. Say you have a physical therapist working in home health seeing COVID patients. They qualify. A physical therapist who is doing outpatient physical therapy probably doesn't qualify. So that being said, it's kind of vague here because you could, say, do what I do and say that you're seeing patients via telehealth because all clinics are closed, well, then maybe you qualify because you're still seeing patients in the COVID, but you're not interacting with COVID. So it's completely vague. Obviously, if you work in a COVID unit or you've been assigned to a COVID unit, maybe all your loans would be forgiven. This is completely vague, and there's too many variables here just because you're going to see so much, I guess, variety within each profession of what people are doing. I mean, there's even some physicians that have just stayed home this whole time and are like, nah, I'm not going to work. So it completely depends. But that is the definition of what's going to get you qualified. If you feel that you may qualify, I would just go ahead and apply. So, I mean, right now I am still doing home health. I've mostly been doing ortho home health because they cut COVID visits for PT, but if I want my loans forgiven, I might just be like, hey, give me some PPE, I go pick up some COVID right now. So this is going to completely depend and be variable. And, if they see that you were employed and licensed during this time, I think that might be enough. I'm not really sure what else is going to happen with this, but we've already covered the applicable loans and we're almost done to the end of the document here. That was really the most important part of this video and what I wanted to break down because nobody really knew what was going on, but we can go into some definitions here just to make sure I don't miss anything. There's some stuff about coronavirus. We don't really care about that. It just tells you about more loans, graduate education. So the term, well, this might be important right here. Sorry if I missed this part earlier. The term graduate means, okay, we know what a graduate education is. It's just telling you the definitions of graduate education, qualifying emergency, the pandemic, obviously. Yeah, it's just going into undergraduate education. So it's just kind of just covering their definitions of everything. But hopefully that broke down the article. Again, my thoughts overall are this could be really good. Will it actually be implemented? I don't know unless the Secretary of Health and Human Services kind of makes a big push and says no to the Secretary of Education and the Secretary of the Treasury. We really don't know what's going to go on. Will this actually pass? I don't know, but hopefully this broke it down. If you like this content, comment below. Make sure you subscribe to the channel. Make sure you like the channel. Comment below with comments, questions, complaints, concerns. Hopefully you can hear me okay. This is a new mic, so I've turned the gain down a bit from my prior videos. Before, my gain was super high. Like if I turn it like this, obviously it you can hear my cat like walking in the background, so we didn't want that. So I've been turning it down. Let me know how the audio quality is, and hopefully this helps you guys understand the bill, or guys and girls understand the bill. Again, I'm Dr. Smith, physical therapist. If you want to see me for a telehealth visit, go ahead and email me. But otherwise, thank you guys for watching. Hope you enjoyed the content, and I'll keep posting out videos or pumping out videos or whatever. All right, guys. Thank you.